Hello everyone, nice to see you again. I'm sorry I planned to have once a week, but I delayed. So this is the second part of the job description about dental assistant. So last time I gave a bit brief about what we usually do and what we should pay attention. So now I would like to explain more details. The topic today is mainly about sterilization, which is also the first job, or you could say the first task you will do as you would learn and start with as a dental assistant. It's it's quite important, very important area. It's also at the beginning it's kind of like alert. It's alert for you um to keep in mind all the time about hygiene, about like clean and not clean. So in the sterilization area, generally we have two sections. The one section is about the dirty instruments, which means every dentist room uses these instruments, and they use for the patients checkup procedures or whatever it is. So these instruments those instruments are exposed to the patients. So this is a part of the dirty instruments. And another section is the clean area. So we have to remember all the time when you are in the sterilization area, you need to wear the glasses, protective glasses, and mask and gloves. So gloves is for the sterilization dirty area. You pick up everything, every instrument. You should be very careful and wear the gloves all the time. And you also have to notice if your gloves if your gloves have any scratch or damages. And then another area, the clean area, you shouldn't wear gloves because it is all kind of, because you just use your hands, right? And you also need to keep using the sanitizer to clean your hands too. So this area is for the clean and hygiene instruments. So to be honest, at the beginning, many of us don't have such kind of awareness to tell the difference between the dirty and not dirty area, dirty area and clean area. We may often forget, we wear the gloves all the time. We may forget to go that area. We should take it off, gloves off, right? So this part, especially at the first 1 day or 2 days, excuse me, it may happen to you that you suddenly realize, oh, I'm sorry, I forgot to take it off. I forgot to wear my gloves. So this is very important because this is a time for you to form to generate an idea of dirty and clean, and you should have very strong mindedness about that. Okay, so for the sterilization area, they are quite simple stuff. So what we generally do is just you need to tear, firstly, protect yourself well. Don't get poke or don't get any injury, especially in the dirty area, because it is dirty instruments. If you don't want to get infected, you should be very careful. Otherwise, for example, if you accidentally cut or get injured and get blooded in the dirty area, then you have to do the blood test, just in case you didn't get any disease affected. So it's quite important. We should be very careful. Be careful about this part. So for the sterilization area, when you put the dirty instruments in the place, and then if you need to put in the how to say that one, generally put in the sink with some chemical stuff, and then you need to put it on the sonic container. It's also with some chemical stuff and with some kind of hot water or something to clean it. That's just the first step. And then we need to dry it and put in the autoclave. So autoclave is like a very high temperature clean to kill the bacteria also, or virus. So for here, just two things we need to, like, except the first of all is keep gloves on and be awareness the instruments, okay, because there are so many the sharps they're quite easy to get poked. So when you do anything about it, just slow down. No need to rush. If it's too quick to rush, it's very easy to get injury. So for this part, this is the first thing we have to be aware of. Then second is so each room they have their own packing. They have their own packing requirements. If you can remember each room's policy, like how they, or you know policy. Sorry, if you know each room's preference, that'd be great. Then you could do a great job there. But like what I said, each room has their own preference. Some room they prefer, some stuff they pack together, and some room they just prefer everything separate, pack individually. So there's about packing for each room, and then also here. And the third part is by the way, each package we should have the cycle date and number. So when the dentist when they put the notes, they also will put the cycle number there. What we should do, what we should be careful about here, except for this. I'm trying to think about it, because generally the sterilization areas many just requiring you could do things be carefully and fast. That's it. So it contains the sterilization job and the lab work together. Oh, so by the way, the fourth part you need to be noted is you need to you need to pay attention about how the instruments, how each room's going on, especially like hand pieces, or the retractors, or some certain like the brocades, like this stuff. Generally each room they don't have much, they don't have a lot, maybe just few in each room. Then when you say some rooms they have several this stuff, these instruments in the sterilization area, then you need to be pay much attention. So it's better to put them into the autoclave earlier. You don't need to wait like 5 trays. Like in our autoclave, you can put 5 trays of instruments inside of it. But like what I just mentioned, each room just have 1 or 2 sets of the retractors. I mean the retractors means the mirror, the retractors, the chair retractors. When you take photos, we need it to retract the patient's the cheeks, so we could take clear photos on their teeth. In this case, then you need to put them in the autoclave and start to sterilize them as quick as you can. Otherwise, other rooms, they may be short of it, And then, if in this case they need to borrow the instruments from other rooms, it's very inconvenient for them. So you also need to keep an eye how the instruments going on. If they said they need some certain instruments as quick as possible, as early as we can, as soon as possible. If they say they need an instruments as soon as possible, then you just need to put those. What do you have the instruments now? Just put everything in to start the cycle. Because all the sterilization, what you do is helping each room to run smoothly, to make sure they have enough instruments. So okay, so that's it for the sterilization area. Not much to talk about, just very important is about keep an eye of the dirty and clean area. When do you need to wear gloves, when you don't need to wear gloves? Just be careful about this and keep it in mind all the time. That's it. So next time I want to talk maybe some about the lab works or author reviews or braces. I will try to have a talk each week and share some dental assistant information, how to do this job well. Thank you everyone. See you next time.